Hello friends, welcome back to AONL. That's the All on Law channel. This is a medical video lecture, microbiology. Medical video lecture, microbiology. Microbiology. And today's topic of discussion is really very important bacteria. That's Streptococci, Viridans streptococci, Viridans strept Viridans strept. Okay, so which are two bacteria that come in this category? The Streptococci sanguis and Streptococci mutans. Right, excellent. Sanguis and mutants. Guys, remember, whenever we talk about Viridans streptococci, think of only one thing, that is dental caries. Dental caries, endocarditis. That's it. Excellent. Now let's move on to this topic. Before starting a discussion on this, I would request you to subscribe, and I would like to tell you brief you about our channel. That's our channel currently has more than 600 medical video lectures on different medical topics. We tried our best to clear the concept, and these videos are really very helpful for USMLE appearing students from step 1 to step 3, and not only for the USMLE appearing students, for other examinations like Canadian examination, Australian examination, MRCP, MRCP-CH, FRCS, and IFORM, other medical board examinations around the globe. If you are clear with the concept, then definitely it will help you to do very well in your any other medical board examination. Okay guys, so let me quickly start a discussion on this. Viridans streptococci, V strept. So what did I tell you? You have to remember the one thing. Whenever we talk about Viridans streptococci, remember about the dental caries and endocarditis. That's a subacute bacterial endocarditis, right? Good example. Now let's start. The two bacteria in this group, one is the sanguis and the mutans, right? Excellent. Now I'm going to talk about the features of this. They are gram positive or a gram negative? Gram positive or a gram negative? Tell me. Is positive. Good. Catalase positive or catalase negative? They are catalase negative. Excellent. Then are they alpha hemolytic or a beta hemolytic? They are alpha hemolytic. Excellent. Are they optocin sensitive or resistance? Optocin sensitive or resistance? They are resistant. Okay. Are they bile insoluble or soluble? They are insoluble. Okay. So they are gram positive, catalase negative, alpha hemolytic, optocin resistance, bile insoluble. Right? Excellent. Now these are the important features. And where do they live? What's the reservoir? Normal flora is a human oropharynx. Oropharynx. That's why what you need to do, you need to clean your teeth all the time. Okay, good. What's the transmission? Transmission is by endogenous. Endogenous. Okay. And how does it cause a dental carie? It forms if this is a tooth, I'm not sure whether I'm able to draw very clearly or not. Oh, that's good. And this is one of your tooth, and you didn't clean this, you didn't brush the tooth properly. Now what happens? This bacteria forms a thin layer. If suppose think that if we want to do over here caries, it forms a thin layer over here. Okay, that's known as dextran biofilm. Okay, and this layer, or what you call this biofilm, helps the V streptococci to get attached and cause dental caries, and same mechanism acts on the heart. If this is a heart, they form a vegetation walls around the mitral walls or tricuspid walls. Okay, they go and they stick together, form the layer biofilm, that's a dextran biofilm, and causes endocarditis, right? So if there is a what you call a dental caries, all right, so they will come with a pain in the tooth. Okay, so and if they are endocarditis, there are a lot many clinical features and very what is life threatening condition also. They can present with the fatigue, malaise, anorexia, night sweats, splinter hemorrhages. Okay, recently I discussed about the Duke criteria. Just you can type Duke criteria by allornonelaw, you will get in YouTube. Okay guys, so what's the treatment for this? How would you treat this? It is nothing but a penicillin G with aminoglycosides for endocarditis. So what we are worried about? We are worried about the vegetations that are caused by the V-strep, right? So we need to treat and we should be very cautious. Penicillin G with aminoglycosides for endocarditis. And how would you prevent that if the patient is undergoing any what you call dental caries, dental work with a damaged heart walls, then he should be given prophylactic antibiotics, right? Prophylactic antibiotics, right? Excellent. So V-strep includes two bacteria, that's sanguis and the mutants. They are gram-positive, catalase negative, alpha-hemolytic, optochin resistant, bile insoluble. They live in oropharynx as a normal flora, and they are endogenous. Transmission is by endogenous, and they form a dextran thin biofilm layer over the caries or vegetations and causes the infection and carry out the disease. Thank you so much for watching this video. I'm sure this video was really very helpful for you for your USMLE examination. Thank you so much. Take care.